Today we will be discussing about the sexual health and hepatitis, its risk, prevention and management. So first of all, what is hepatitis? Hepatitis is a viral infection that attacks the liver, right? So there are several different viruses that causes hepatitis, each with own characteristics. So there are five main types of hepatitis virus. They include A, B, C, D, and E. So let's discuss each one. So these types are hepatitis A spreads through contaminated food, water, or usually causes mild illness. Hepatitis B transmitted through the bodily fluid, including blood and semen, and it causes chronic infection. Hepatitis C are primarily spread through the blood-to-blood contact and can lead to the serious liver disease, damages. And hepatitis D requires the presence of hepatitis B for co-infection and worsen the course of hepatitis B. So hepatitis E are similar to the transmission route to hepatitis A, which is food and water, and causes outbreak in developing countries. So now as per our topic, we will be discussing more about hepatitis B and C as they are transmitted through the sexual course. So what is hepatitis B? Hepatitis B is a potentially serious liver infection caused by hepatitis B virus, that is HBV. HBV is a highly contagious virus that can be spread through contact with the infected blood, semen, and vaginal fluid. It can occur during the unprotected sexual contact, sharing needles, syringes, or exposure to the other bodily fluid. So hepatitis B can cause acute or chronic infection. Acute hepatitis B can resolve on its own, so no need for a treatment. But chronic infection can lead to the serious liver damages, including cirrhosis and liver cancer. So what are the symptoms of hepatitis B? Symptoms of hepatitis B vary depending upon its stage of infection. So in acute stage, some individual may not experience any symptoms, but in severe stage, that is in chronic stage, symptoms do occur like fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, pain stool, and jaundice, like yellowing of the skin and eye. Now coming to the complication, hepatitis B can be damaged liver, increased risk of liver cancer. It causes chronic fatigue, joint pain, and early diagnosis and treatment can prevent all these complications. Now coming to the hepatitis C virus. Hepatitis C is a liver infection caused by hepatitis C virus. HCV is primarily transmitted through blood-to-blood contact. As we see as we have discussed, hepatitis B virus is transferred through the sexual contact, but unlike hepatitis C, transfers through blood-to-blood contact. So this occurs through sharing needles, syringes, getting unsafe tattoo or piercing, or exposure to the infected blood during the childbirth. In contrast, as we discussed, hepatitis B is transmitted through sexual contact. So HCV is less frequent and can occur. Sexual transmission can occur in HCV, but it is very less. So it is usually caused due to the unprotected anal sex in presence of or other transmitted infection. So hepatitis C often causes no symptoms in early stage. That makes it difficult to diagnose. However, if it is left untreated, the chronic HCV infection can lead to serious liver damages. Now coming to the hepatitis C symptoms. So it also causes fatigue, nausea, loss of appetite, abdominal pain, dark urine, pale stool, and joint pain. Now, complications are pretty much similar to the HBV virus. It causes liver damage, cirrhosis, liver failure, and liver cancer. Now coming to the prevention. Prevention can be done by vaccination, safe sex practice, avoiding sharing needles and syringes, and getting tested regularly. So in vaccination, there are safe and effective vaccines available for hepatitis B, but there are currently no vaccine available for hepatitis C. But the research is still ongoing on that part. So using condoms consistently and correctly can significantly reduces the risk of sexual transmission of hepatitis B and C. It is crucial to prevent the bloodborne transmission of hepatitis C by avoiding sharing needles and syringes. And regular testing is essential for early detection and treatment for any kind of hepatitis actually. Now coming to the management of hepatitis. There is no cure for hepatitis B, but we can effectively manage the virus and prevent the complication. So most of the cases, the infection of the most cases, newer medication offering high rate and minimal side effect. So regular doctor visit and monitoring is crucial for people living with hepatitis B and C. Coming to the conclusion, hepatitis B and C are preventable and manageable infection. So by following safe sex practice and getting vaccinated for hepatitis B and seeking regular testing can significantly the risk of the disease. Early diagnosis and treatment are essential to prevent the complication and improve the long-term health outcome. If you have any question or queries concerning hepatitis, so I will suggest you please do talk to your doctor. They can advise you the best course of action and for your individual situation. Thank you for patience listening.